Thank you to Jay Inslee personally, because I always appreciate that you always write people back when they email you.
He does.
I appreciate that. And then I'm going to give you a little bit of my situation first and then ask my question. My husband has Crohn's disease, which is a very serious disease that, with certain complications, could kill him if he doesn't get timely health care. So with that, I have a couple questions. First of all, would we have to get permission for certain procedures? Do we need to get approval before they happen? And then, sorry. Also, it talks about the healthcare bill. I'm reading it myself, and it mentions in a couple different places whether or not people are eligible for procedures. And so that, to me, implies that at some point, someone's going to be denied some coverage. And if that happens, do I have the option to go around and pay for it out of pocket? Because in Canada, you can't do that. And I actually have a friend in Canada with a very similar disease who is not getting the healthcare coverage he needs. And he has internal bleeding. So it's really important for me to know if I can choose to pay out of pocket, because I would rather be paying for it for the rest of my life than lose my husband.
You're thinking of your husband. I hope things go well for you. There's nothing in the bill that puts a federal bureaucrat between you and your doctor. I can just tell you that. I looked at the bill. There's just nothing in the bill that doesn't do that. Today, there are many things that put an insurance bureaucrat between you and your doctor. So obviously, I can understand how you're concerned about this. I would be too. What I'd like to do is, you've made reference to some things in the bill you've looked at. Patrick is standing right next to you. If you can make sure that we can communicate and look at those things in the bill that give you concern, and I'll address them specifically. There's nothing there that would prohibit you from buying any other policy if you wanted to, but it does require at least a minimal level of protection. So let's take a look at where your concerns come from, and I will get you a very specific answer to those concerns, okay? Patrick, make sure that we get this young lady's name, and we'll do that. Thank you very much. Thank you.
The concern is that, to me, this healthcare debate is kind of a camel that's going to be breaking the camel's, or the straw that's going to be breaking the camel's back. Since President Obama was elected, there's been a takeover of private enterprise, both at the banking and automotive. And small business throughout this country.
Sorry, what was your comment?
Cap and trade, which I'm really here for. That is another tax on small business. We're the ones that bear the brunt of all this. Taking over the healthcare industry in this country, and I don't care what anybody thinks, that's what it will be. And as a small business, it's like about 20 people, we can't survive, and folks, we're the ones that pay the bill.
Well, I think we all know how important small businesses are. Community is the place creativity comes from, it's the place innovation comes from. So, and speaking as a guy who had to make a small payroll when we had about 15 employees in a little small business store in Yakima County, I think I have some sense of the importance of small businesses. An additional ability to obtain insurance of your choice, of your discretion, without any federal bureaucrat either incentivizing or ordering what to do to buy insurance, because it will give you a tax credit of about 50% of the cost of providing insurance to your employees. Now, should you desire, you can desire any insurance policy you decide, as long as it meets some basic requirements that are going to be decided. That is one place, by the way, that is one place where there would be a government decision here, that there would be a basic level of health care that we could say all insurance companies will have to at least provide a basic level of insurance policies. But above that, or sideways of that, that would remain your choice. So, standing here, I sense, when I listen to people who have these concerns, I think there is an overwhelming concern about any government activity. But it reminded me, I was at this meeting in Kitsap County the other day, and a very nice young woman stood up and said, I think government activity in healthcare is unconstitutional. And I said, where do you get your healthcare? And she said, from the federal government. I said, what do you think of Medicare? Do you think Medicare is unconstitutional? She said, maybe. That could be unconstitutional. How about Medicaid? Yeah, that might be unconstitutional. So I guess what I'm saying is, when I look at this, how it affects your life, I think it will give you additional choices if you decide to implement them. And choice will not be intruded. Now that's how I believe it will affect your small business, and that's the best I can answer your question.
I had a question about how these health insurance exchanges are going to work. It sounds like a bunch of people will get together in an exchange and they will be able to cooperatively negotiate with the public option, with the private insurance companies, and get what they want. But what I've read a bit about, and I don't know if this is true or not, so please correct me, but it sounds like it will take a long time for the public option through this health insurance exchange to come to people. What I've read says that the uninsured and the smallest of small businesses will be able to negotiate for that, but large companies, I'm fortunate enough to work for one and have decent health care, but large companies won't be able to join in on the public option. So my question is, how's the public option supposed to get a healthy customer base if it's limited to such a small size? If there's only so many people that can join in.
Well, the public option would be a national program. So you're going to have a number of people. They asked a question about this, and the CEO has predicted that about 3% of Americans in the first decade would probably go into it. That's still a significant number of people. So I think those who have evaluated it do believe it would have at least an adequate number of people to make it viable. The exchange that you're talking about will not be a negotiating entity. The exchange will not negotiate rates for coverage. It will be largely a clearinghouse of information so that you can judge on a comparative basis the coverage that one policy would provide or not. So I think the way to think of a clearinghouse is just that. It's a clearinghouse of information. You try to help you make an intelligent choice of multiple insurance companies. It's really nothing more, nothing less. So it won't be part of the negotiating part.
My overall question is, how we can have public education in this country and not have a public health care option. For a healthy democracy, we need intelligent, educated people, but we also need healthy ones. I've worked in healthcare for 20 years. I'm not speaking here for myself. I have excellent health care. Even as a cancer survivor, I have excellent health care. My father was a retired lieutenant colonel, has excellent health care. My mother, who's 75, has good health care. I'm here because I see people leave the hospital who are sick, who I go home and think about, because they don't have health care to pay for a new prosthesis, and then they can't go back to work, and they can't afford health care, and then they become often very despondent or suicidal and come back into our hospitals, or overuse our emergency rooms, which you all have to pay for at a much, much higher rate. My question is basically, how can we say yes to a public option in education and not a public option in healthcare to keep our citizens healthy?
Thanks for being so eloquent on it. We reached the point of our meeting, and I just make a couple of closing comments. First off, I want to thank everyone who's come here today, whatever your opinions. It was very valuable to me. People have been, by and large, very, very civil to one another, and I'm very appreciative of that.